Unit 4, Part 2. Let's carry on. When can late joiner penalties apply? So if a person has been a beneficiary of a scheme within 90 days, preceding an application, so within 90 days before they submit the application for a new scheme or to join a scheme, and has been a beneficiary of one or more schemes for a continuous period of more than 24 months, in other words, more than 2 years, the scheme may impose the 3 months, sorry, not years, 3 months general waiting period, but this will not apply in respect of your PMBs. Remember, they must always cover the PMBs. The waiting periods are applied to the member and their adult dependents individually. So they will look at the member and each dependent individually. A member cannot buy out any waiting period, so you cannot offer them 2 or 3 or 5,000 rand upfront to buy yourself out of that, and cannot remain a member of one scheme and join another scheme at the same time in order to cover while you wait for that waiting periods on the new scheme to apply. So you're not happy with your current scheme, you want to join another scheme, but that another scheme gives you 3 months or 12 months waiting periods. Now you said, okay, I'm not going to resign at this scheme. I'm joining that scheme, so I'm paying for that until my waiting period is over at this new scheme. The moment my waiting period is over here, then I'll resign the scheme. No, because you know what? Remember what the Act says and the law says. CMS says you are not allowed to belong to two medical schemes at the same point. Section 28 reads, no person shall, and here it says it as well, A, be a member of more than one scheme, just what we talked about now. Section 28 of the CMS says, you shall not be a member of more than one medical scheme. In other words, you can be a member of only one medical scheme. That is it. No person shall be admitted as a dependent of more than one member of a particular medical scheme or members of different medical schemes. In other words, for the children, here are you, the child. Now your parents maybe get a divorce. Not that I hope it does, but for those whose parents are divorced, let's rather take that. Here is dad with his, and there is mother, mum. So you cannot be a member, a dependent on your mother's medical aid and a dependent on your father's medical aid. That cannot happen. You have to choose either or. And then you must cancel the one. And then you just stay on either your dad's one, or you must cancel your dad's one and then you stay on your mother's one. All right. Or you cannot be dependent of members with different schemes. So even if your parents are married, but your dad just get the medical aid from his job and your mother's get one from her job, and your mother don't want to be dependent on your father's one, and your father don't want to be dependent on your mother's one, then you cannot be on your father's medical aid and on your mother's medical aid. You have to be on either one of the two. I know people that do it that way because the husband's company pays their full medical aid, and he's happy with the benefits. The wife is not happy with the benefits she's getting at the husband's medical aid. She wants to stay on her medical aid at her work because she like her benefits, but the husband don't like the benefits there. So they've decided he stays on his medical aid at his work that they pay, and she stays at her work at her medical aid is they pay, and the kids is under the husband's medical aid. Boom. Problem sorted. So in that case, the children cannot be on both medical aids. C. Claim or accept benefits in respect of himself or herself or any other dependent from any medical scheme other than the medical scheme of which he or she is a member. If a member moves medical schemes before a waiting period has expired, the new scheme may apply the unexpired duration of the waiting period imposed by the previous scheme as well as any new waiting period that applies. So, let's say you had a 12 month condition specific, although I like condition specific, although I like the word specific condition actually more. Specific. Now you've done 8 months already of that waiting period. So you're left with 4 months. Left with 4 months. If you go to the new scheme, they will just take over that 4 months and not the full 12 months. And then you carry on with that 4 months. That is what they mean there. At the new scheme. You don't have to start afresh with 12 months again. Okay. The specific information needed to determine whether a late joiner penalty applies or not must include the following. So, to see if a client must pay late joiner penalties, you ask the client, how old are you? Is the applicant 35 years or of age or older? Yes or no? I'll just make a Y for yes and an N for no. Was the applicant of one or more medical schemes as from a date preceding 01/2001, yes or no? Then you can say yes or no. And what they mean here by one or more medical scheme. Like in my case, I used to be with company A medical scheme, and then later I jumped over to company B medical scheme, and then I jumped over to company C medical scheme. So I was at 3 different schemes. So that is what they mean by one or more. I was at more than one medical scheme, but I was at 3 medical schemes continuously. So then they want records of, so let's say I want to go and join a company D medical scheme. They're going to ask Jaco, okay, but you want to see, where's your proof that you've been? So I must then go to company A and send them proof that I joined them as a medical scheme. Then I'll go to company B, I send them the proof I was there, and then I'll go to company C and I'll send them the proof. So now the new company see that I've been at company A, company B, company C. I've been at more than 3 medical schemes since that date. So then I don't have to pay late joiner penalties. Prior to application, did the applicant have a break in coverage exceeding, in other words, more? Did they have the break of more exceeding than 90 days of 3 consecutive months since 1 April 2008? Yes and no. And if an applicant is older than 35, you said yes. Was the applicant a member of one or more medical schemes? If you said no. And before the application, did the applicant have a break preceding 90 days? Yes. You'll pay late joiner penalties, LJP. So let's see how we calculate this. How is a late joiner penalty calculated? The additional contribution payable by a late joiner to a medical scheme is calculated using the formula described in Regulation 13. So here on the left hand, we look at the number of years an applicant was not a member of a medical scheme. And then you'll see they put them in 1 to 4 years. He wasn't on the scheme. 5 to 14 years, 15 to 24 years, or more than 25 years. And what is the maximum penalties? Here you look at the contribution, which will be that 1,000 rand a month or 2,000 or 3,000 times, and then you look at the penalty times 1.5, or the contribution of 1,000 rand times 1.25, or the contribution times 1.5, it's 1.5, or if the person was not on a medical scheme for 25 years or longer, they're looking at the contribution times 1.75, nearly double. All right, so here we look, this is the formula you use. A equals B minus, in brackets, C plus, C 35 plus, 35 plus C. Now, you have to calculate A. What is the penalty band? So, these ones will be A. Also, yeah, both will. Yes, A. So, you'll have to calculate to decide, do they fall here, do they fall there, do they fall there, or do they fall there? If they fall in this one, you use that formula. If they fall here, you use that one. If they fall here, you use that one, you see, and if they fall here, you use that one. And let's change some colors for this other one. You can, and if it's there, it's there, you see. So you must work across the lines. If I can just keep my hand steady, yeah. So they work together, they work together, they work together, and they work together. So B will be the age of the applicant at the time of the application, and then C will be the number of years of proven credible cover, the number of years that person can prove to you they have been on a medical scheme. All right. So because, if I go one slide back, is the applicant 35 years or older? Because it's always about the 35. Okay. That is the reason they use the 35 in the formula. Always. Unless they've changed it in the law or the regulations, then they will probably change the formula. They will just add it. But that's why. Okay. So credible coverage. To determine the late joiner penalty to be charged to an applicant, the medical scheme considers any qualifying periods of membership of a registered medical scheme since 1 April 2001. But credible coverage is defined in Regulation 11 to mean the following: any period in which a late joiner was either a member or a dependent of a medical scheme, they will accept that, or B, a member or a dependent of an entity doing the business of a medical scheme, which at the time of his or her membership of such entity was exempt from the provisions of the Act, or C, a uniformed employee of the South African National Defence Force, in other words, the Army, or a dependent of such an employee who received medical benefits from the South African National Defence Force, or D, a member or a dependent of the Permanent Force Continuation Fund, or E, but excluding any period of coverage as a dependent under the age of 21 years. So these people are also credible coverage. This, all these A, B, C, D is also credible coverage. All right. So, yeah, they can also hand in their things. So, let's look at an example. Peter wants to join a medical scheme. He is 40 years old and his wife is 34. Neither he or his wife has been a member or members of a medical scheme before. The scheme contributions relevant to the option he has selected are as follows. The principal member, in other words, Peter, must pay R1,000 a month, and an adult dependent, his wife, must pay R900 a month. As Peter is over the age of 35, I see the problem, you see. Every time you see a client and they are older than 34, you must look at late joiner penalties. A late joiner penalty may apply. We don't know yet because we need to put it in the formula, use the formula to calculate, get the number, then we go and compare. All right. So, but it may apply because his age tells you it's more than 35. You must always say, okay, before it's because it's more than 35, a late journal penalty may apply, but I need to do the calculations before I can definitely say yes, no, and how much. So no penalty will apply to his wife as her age is under 35. You see, because she's 34, then it doesn't matter. Peter has never been a member of a medical scheme and therefore does not have any credible coverage. Or that might be a problem. Never been a member of a medical scheme and have no credible coverage. You know that red light? Like a globe. I'm trying to draw a globe here for you. Problem. Ding, ding, ding. Alarm. So apply the formula for the late joiner penalty. So the formula, we say, the formula you always use is A equals B minus in brackets 35 plus C. So B, we said is, can you remember? The age of the member is 40 years old. Minus 35 plus 00 because they've never been on a medical scheme. So the C stands for credibility. So they cannot prove it, so it's 0. So then 35 plus 0 gives you 35. Remember in maths, if you've forgotten, you always do the things in brackets first. Always. Okay, so therefore we must first work out the brackets. That's 35 plus 0 is 35. There we got our 35 and is 40. So 40 minus 35 gives me 5. That is my A. A equals 5. All right. So we said A is the penalty bracket where it's going to lie. So here I've got 1 to 4 years. No, he is 5 years. Number of years an applicant was not a member of a medical scheme. That was 5 years. That is how they calculate it. So because he falls in that bracket, we must use this one, the contribution times 1.25. So therefore we says Peter falls in the penalty band of 5 to 14 years. And here we've got it 5 to 14 years. Where a penalty or surcharge of 25% will apply, that's correct. Because 1.25, yeah, it's 25%. So apply. So therefore, he must pay. He was supposed to pay 1,000 rand a month, but his late joiner penalty is times by 1.25, and therefore his new premium will be 1,250. So Peter is paying a 250 rand penalty fee every month, and 250 of 1,000 is 25%. Okay. So he will be paying that for the rest of his life as long as he's on a medical scheme. And now people think, oh, but they're not going to pay it. No ways. They're going to leave it. Then they get a hospital plan or nothing or whatever. But then later in life, they get so sick. Then they want to join. But but see the problem now. Later in life, when they want to join, then they might fall in the 15 to 24 years. Then they're not going to pay that 1.2, then they're going to pay 1.5. So then his premium will not be 1,250, it will be 1,500. Then he pays 500 Rand a month more for the rest of his life. And if he still decided, no, bugger this, it's cross, he doesn't want it, because there's people doing this. And then they realize, oh my goodness, I'm now so sick, I must get the medical aid. So let's try again, let's phone a broker. Then the broker comes there. The broker said, sir, ma'am, for 25 years plus, you have not been on a medical aid. Yeah, but every time they want to charge me late joiner penalties, and I wasn't prepared to pay that. Bugger them. Then he said, but sir, look at the problem you've caused yourself. Now you must pay 1.75, 75%, where you could have just paid 25 if you've taken it there. Or you could have paid 50% if you've taken it there. But here you were too cross, you said no. There you were too cross, you said no. Now you must pay 75. So instead of 1,000 Rand a month, you're going to pay 1,750 for the rest of your life, as long as you're on a medical scheme. Unless they've changed the law or the rules. You see? So I would then rather say, listen, don't be like that. If you fall in there, take it. It's 500 Rand cheaper than that. Okay. And tell that to your clients as well. When you sit with them and they start, no, no, no. Then you tell him, sir, look where you fall. Especially if they are in 4 years. He said, you're on 4 years now, sir. You only pay 0.5. But if you phone me next year, and what is going to happen next year? Next year, you're going to not be that 4 years. Next year, you fall into 5 years because it's a year later. Then it jumps from here, from the 0.5. It's going to jump to the 0.25 to 25%. Tell them that, and they'll tell them if they want to think, they must think before that 4 turns to a 5. They've got a couple of weeks or months, depending. And maybe then you can quickly work out the calculation is age, and then you can see, when is your next birthday? Ooh, we've got 2 weeks, or we've got 2 months, or 3 months, or whatever. Right, and then maybe they can join quickly. Let's look at another example. John wants to join a medical scheme. He is 50 years old and his wife is 44 years old. They have been members of a medical scheme for 5 years in a row, but more than 90 days before. The scheme contributions relevant to the option they have selected are as follows. For the principal member, like for John, it's 1,500 Rand a month, and for the adult dependent, his wife, will be 1,000 Rand a month. As John and his wife are both over the age of 35, alarm, ding, 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 ding. You see, that is how you must think when you sit with your client. They are both older than 35 because he's 50, she's 44. So immediately I can tell my client, listen, a late joiner penalty, must of may apply. I cannot say because I now need to go and put it in the formula. John and his wife have been members of a medical scheme. Yes, they've been members of a medical scheme for 5 years, so I'm going to use that 5 in the formula as well. And therefore, because that's some credible coverage. So then you tell the client, okay, client, come, sit with me, let's work it out. We use the formula. First, we calculate for John. The formula we use is A equals B minus 35, in brackets 35 plus C. What did I always say? You do the brackets first. So you close the brackets in red, and you said, what is 35 plus 5? It's 40. So John is 50. So 50, John's age, minus the 40, it's 10. Now you ask me, where do I get this 5? Remember the C. That C in the formula stands for credible coverage of medical scheme. And they had a medical scheme for 5 years, remember. That is why. If they had medical scheme for 7 years, I would have put in there 7. If they had medical scheme for 8 years, I would have made it 8. Then it will be 35 plus 7 or 35 plus 8. Whatever years coverage they can provide, that is your C. That is the amount you put in there. All right. Because C is your credible coverage. So, because I've got a 10 there, A is 10, I must go and see where is 10. Here is no, it's 1 to 4, it's no 10. 5 to 14. So, I want to be in that bracket. Because 10 years fall in that bracket. And that bracket works with this one. You stay in the same line. The contribution plus 1.25. That is 25% of the premium. Then you said John falls in a penalty band 5 to 14 years. That's correct. Where the penalty or surcharge of 25% will apply to his contribution. His contribution, as we said in the previous slide, is 1,500 Rand a month times 1.25. That will give you an amount of 1,875 Rand per month. So John is paying 375 penalty each and every month for the rest of his life. As long as he's on a medical scheme, that is his penalty. All right. You can also see 25% of the contribution is 375. Because if you take 375 and you times it by 4, it will give you 1,500 Rand. Check on your calculators. So 375 is 25% of 1,500. It's a quarter. All right, so now let's go and look at John's wife. Now we're going to do the calculation for John's wife. We said C, that's the formula. C is 5. You know why? It's the 5 years credible coverage. So then we do the brackets first. 35 plus 5 is 40. She is 44 years old. So it's 44 minus 40 is 4. So where does 4? Oh, 4 is in that bracket. There it is. You see 4. So she falls in this bracket. Therefore, her penalty is only 1.05. That is 5%. So John's wife fall in the 1 to 4 years, where the penalty of surcharge of 5% will apply to her contribution, or his, depending on who's paying at the end of the day. Maybe it's his, but I presume he's going to pay. So 1,000 Rand, her monthly adult dependent fee, times 1.05 gives 1,050 Rand. So she's only paying 50 Rand, because 50 Rand is 5% of 1,000. So now you must sit with your clients. You said, okay, my client, Mr. John, your new monthly premium is not 1.5 anymore because you're paying that penalty fee of 375. You are going to pay them now 1,875. And for your wife, she's not going to pay 1,000 Rand. She's got a penalty of 50 Rand. So she's going to pay 1,050 Rand. Therefore, instead of John and his wife paying the normal fee, sorry, sir, you're my dearest client, I love you to bits, but unfortunately you caused a problem for yourself. So you should have paid 2,500, but now you will pay a total new premium of 2,950 Rand a month. So a total of 425 per month. You see the 375 of John plus the 50 Rand of his wife gives me 425 Rand in total. And this is the amount Here, they must pay extra for as long as they're on a medical scheme for the rest of their lives because of the late joiner penalty. They will pay 2,925 Rand a month instead of 2,500. So it's an extra 425. If you take 425 times 12 months in a year, oh, that will give me 4,200. Let's call it 5,000 Rand for the year. And if they stay on that medical scheme for 10 years, they're going to fork out an additional 50,000 Rand over 10 years. By the age he's 60 and she's 54. You see what this has an influence on your budget. So they can be lucky they could approve 5 years in the medical scheme membership. Otherwise, they would have paid more in latent penalties. So they can be lucky they had it 5 years. Otherwise, they would have paid 25 or 50% or 75%. So yes. So when you look at managed healthcare, people, if you don't understand the calculations, please send me emails and I will help you with that. But I do hope I explained it and everybody understand it. All right, let's carry on. Managed healthcare. Regulation 15 defines managed healthcare as follows: the clinical and financial risk assessment and management of healthcare with a view to facilitating appropriateness and cost effectiveness of relevant health services within the constraints of what is affordable through the use of rules-based and clinical management-based programs. The regulations also define rules-based and clinical management-based programs to mean a set of formal techniques designed to monitor the use of and evaluate the clinical necessity, appropriateness, efficacy, and efficiency of healthcare services, procedures, or settings on the basis of which appropriate managed healthcare interventions are made. A medical scheme can decide to provide managed care services internally, or it can outsource these services to a managed healthcare organization. A managed healthcare organization, an MCO, refers to an organization that's been accredited by the CMS as an MCO to contract with a medical scheme in terms of Regulation 15A to provide a managed healthcare service. When you look at provider contracting, this function is mainly responsible for setting up arrangements for the delivery of PMBs by preferred providers, also known as designated service providers, DSPs. Preferred providers or DSPs arrangements can be set up with doctor group like PrimeCare and CareCross, pharmacies like Strix or Dischem. Yay, it's my pharmacy where I get my medicine. And even contracted independent pharmacies and hospital groups like the NHN, Netcare, and Mediclinic. As explained before, members who choose not to use the DSP contracted by the scheme may have to pay a portion of the bill as a co-payment. So if your doctor or your pharmacy is not in that designated service provider, you can go to them, but you probably have to go pay in a co-payment. This co-payment must be registered in the scheme rules and could be either a percentage co-payment or the difference between the DSP's tariffs and the fee charged by the member's chosen provider. So if they said, okay, the tariffs for the DSPs is 150 Rand for a GP visit or consultation, and your GP charges 180 Rand, so 180 less 150 is 30 Rand, then you have to pay the co-payment of 30 Rand. Okay. Medical schemes also have to ensure that it is easy for members to get the DSPs. In the event of an emergency condition like an MVA, medical scheme members are permitted to go to the nearest hospital for treatment, even if it's not a DSP, and the scheme is obliged to cover the cost. So if you are supposed to go to the DSPs, but you're in an accident and it's serious and a normal hospital is closer, they'll first take you to the normal hospital, they'll help you there, they treat you there, and then from there on, they'll send you to the DSP. So, and the scheme is obliged, you see here, and the scheme is obliged to pay that cost of the normal hospital that was out of your DSP. They have to do it because it's an emergency. Medical schemes also have an obligation to ensure that their contracted DSPs can deliver the services needed without members having to wait unreasonably long. Where the DSP is unable to accommodate or treat a member, the medical scheme remains liable for all the cost of treating the PMB condition at a non-DSP. It presents a challenge for those schemes that have chosen the state's healthcare facilities as DSPs. Before they can be listed as such, schemes have to make sure that these facilities are within reasonable proximity to the members and that the required treatment, medication, and care is available and accessible. Regulation 15 defines a participating healthcare provider as a healthcare provider who, by means of a contract directly between that provider and the medical scheme in terms of Regulation 15A, or pursuant to an arrangement with a managed healthcare organization which has contracted with a medical scheme in terms of Regulation 15A, undertakes to provide a relevant health service to the beneficiaries of the medical scheme concerned. A designated service provider is defined in Regulation 7 as a healthcare provider or group of providers selected by the medical scheme concerned as the preferred provider to provide to its members diagnosis, treatment, and care in respect of one or more prescribed benefit conditions. Okay. So the one is a participating healthcare provider and the other one is a designated service provider. Tariff negotiations. In the negotiation of tariffs with contracted DSPs, the MCO will generally prefer to agree on alternative to the fee-for-service tariff structure. One such example is a capitation agreement. What is a capitation agreement? Is defined in Regulation 15 as an arrangement entered between a medical scheme and a person whereby the medical scheme pays to such person a pre-negotiated fixed fee in return for the delivery or arrangement for the delivery of a specified benefits to some or all of the members of the medical scheme. They can maybe tell a doctor, you normally charge 150 for this procedure, but we'll give you we'll make a deal with you that you charge all the people a fixed fee of 99 Rand for the delivery or arrangements for the delivery, then we'll pay you quicker or whatever. Hospital risk management. This includes the pre-authorization of a hospital event by the person requiring hospitalization, and the event itself is then reviewed concurrently and retrospectively. The level of care rendered during the hospital event is managed through the case management process, which refers to a process of engagement between the medical scheme and the treating doctor to assess whether the desired level of care is being rendered at the appropriate time, for example, intensive care in the hospital, and whether the patient could not equally and effectively be treated in a general ward without compromising the outcome of care. Disease management program. These programs focus on achieving optimal control of common high-cost chronic diseases associated mainly with the PMB such as asthma, diabetes, HIV and AIDS and oncology. These programs use treatment protocols based on evidence-based medicine to manage these disease conditions. So they control the diseases by giving the people the asthma pumps or the medicines, etc. So a protocol is defined in Regulation 15 to mean a set of guidelines in relation to the optimal sequence of diagnostic testing and treatments for specific conditions and includes, but it's not limited to, clinical practice guidelines, standard treatment guidelines, disease management guidelines, treatment algorithms, and clinical pathways. Then you get evidence based medicine. That is defined in Regulation 15 as the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of beneficiaries, whereby individual clinical experience is integrated with the best available external clinical evidence from systematic research. Pharmacy benefit management. This process provides for the authorization of medicine for the treatment of PMB chronic conditions according to a drug formulary. The formulary is a restricted list of approved medicines used in a treatment specific chronic conditions. These prices lists usually stipulate the use of generic medicine when available. Certain original drugs may not be available on the formulary. If the member's drug of choice is not on the formulary, the member will have to pay for the difference in cost between the original and formulary drug, or alternatively, be willing to accept the formulary drug. So, yes, if it's not on the list, you'll have to pay extra or you have to accept the formulary drug, which is basically like the generic, which is the same thing. It's just a cheaper version. All right, any questions? There's my email address. You know what to do. See you in the next unit. Cheers.